In this lecture, I will discuss monitoring of blood pressure, stages of hypertension, and algorithm or treatment chart of hypertension. When patient comes to you, first check his blood pressure. If blood pressure is equal or greater than 150 by 90 millimeter of mercury, then offer him ABPM or HBPM. ABPM or ambulatory blood pressure monitoring is a 24-hour monitoring of blood pressure in which a BP machine is attached with patient body which monitor BP for 24 hours. In HBPM or home blood pressure monitoring, a manual BP checking at home. Find average of BP for 24 hours. If ABPM or HBPM is less than 135 by 85 millimeter of mercury, then there is no need of treatment. Just monitor the patient BP weekly or monthly. If ABPM or HBPM shows BP of equal or greater than 135 by 85 millimeter of mercury, this is stage 1 hypertension. Treat if age of the patient is less than 80 years with diabetic mellitus, renal disease, CVS disease, or neuropathies. If ABPM or HBPM shows BP of equal or greater than 150 by 90 millimeter of mercury, this is stage 2 hypertension. Offer treatment for him. Stages of hypertension. Stage 1 hypertension, when clinic BP is equal or greater than 140 by 90 millimeter of mercury and average ABPM or HBPM is equal or greater than 135 by 85 millimeter of mercury. Stage 2 hypertension, clinic BP is equal or greater than 160 by 100 millimeter of mercury and average ABPM or HBPM is equal or greater than 150 by 95 millimeter of mercury. Severe hypertension, when clinic systolic BP is equal or greater than 180 millimeter of mercury and diastolic BP is equal or greater than 110 millimeter of mercury. Algorithm or treatment chart of hypertension. Treat hypertension according to the age. When age is less than 55 years, when age is greater than 55 years. For age less than 55 year, treat with A, that is ACE inhibitor or angiotensin converting enzyme inhibitor. So all newly diagnosed hypertension is treated with ACE inhibitor if patient age is less than 55 years. For age greater than 55 year, treat with C, that is calcium channel blocker. So all newly diagnosed hypertension is treated with calcium channel blocker if age is greater than 55 year. This is step 1 of hypertension management. If blood pressure is not controlling, then add both of these, A plus C, that is ACE inhibitor plus calcium channel blocker. This is step 2 of hypertension management. If BP is still not controlling, then add D, that is thiazide diuretics. So A plus C plus D, that is ACE inhibitor plus calcium channel blocker plus thiazide diuretics. This is step 3 in hypertension management. If BP is still not controlling and potassium level is equal or less than 4.5 millimole, then add spironolactone. If potassium level is greater than 4.5 millimole, then add a high thiazide diuretics. This is step 4 of hypertension management. So it's all about treatment chart of hypertension. So guys, if you like the content, then